Welcome to T's Voices, telling the stories of the people in our NHS community.
My name's Elliot Kennedy. In the studio today we have Anne and Lynette. They're here to talk about heart failure. Exactly what is heart failure?
So I think first of all it's important to say that it doesn't mean your heart is about to stop. Heart failure is a condition that means your heart pump is weaker than normal, and because of this it can affect your heart's ability to pump oxygenated blood around the body, and it can be caused by many different conditions.
So what are the most common signs and symptoms of this condition?
So some of the most common signs and symptoms include feeling short of breath, not being able to lie flat because you're feeling breathless, swollen ankles because of fluid building up, and sometimes your tummy can swell because of fluid, tiredness, a persistent cough and a lack of appetite.
And how is it diagnosed?
So usually the patient will present with these symptoms, and then because of that, the GP or the healthcare professional, whoever they've seen, will do a simple blood test called a pro-BNP to rule in or out heart failure. And if that comes back raised, then they may well be referred on for an echo, which is a jelly scan of the heart.
And what are the most common conditions that can lead to the heart muscles weakening?
So having a previous heart attack, high blood pressure, heart rhythms such as atrial fibrillation, problems with the valves in the heart, any congenital heart problems, and other conditions such as obesity, anemia, drinking too much alcohol, an overactive thyroid. Some chemotherapy drugs can also cause weakness to the heart muscle pump, and recreational drugs can also be a factor for this.
How many people live with this condition in the UK?
There's around 900,000 people in the UK that live with this condition, and each year approximately 200,000 new cases are diagnosed, mainly due to an ageing population and also improved survival rates after having a heart attack.
So how easy is it to treat?
I think the thing to say about how it's treated is first-line treatment is with medication. This aims to improve the heart muscle pump and also reduce its progression, and aims to control the symptoms that my colleague has previously mentioned. Also making lifestyle changes such as exercising, eating a balanced diet, stopping smoking, reducing or abstaining from alcohol will all contribute to lowering the risk of developing this syndrome.
So what's the outlook for someone who has been diagnosed with a heart condition?
Well, people can live well with this condition depending on what's caused the muscle to be weakened in the first place. Tablets are normally lifelong, and we encourage people to live well beyond being under our care. And once we've discharged a patient, if we've got them all the tablets to support their heart muscle, we offer them a facility that they can self-refer back to us into our service if they do develop symptoms.
So why is it important to raise awareness?
Well, as we've said previously, each year 200,000 people are diagnosed with this condition. So it's really important to continue to raise awareness of this condition with our colleagues, patients and visitors to the hospital. Sometimes our patients will not always be on a cardiology ward due to other health reasons. So we feel it's really important, and we want to engage with the ward so that they know who we are, how we can help, how they can recognise the signs and symptoms of heart failure.
Anna, Lynette, thank you.
Thank you for joining us. Till next time, you've been listening to T's Voices.